Pituitary dwarfism is a medical condition where a person's body does not grow to normal adult size because the pituitary gland does not make enough growth hormone. Imagine a garden that receives very little water. The plants will stay small. In the same way, without enough growth hormone, the body stays short. The most common reasons are a birth defect that leaves the pituitary gland underdeveloped, damage from a brain tumor, surgery or radiation that hurts the pituitary, certain gene changes that affect hormone production. Think of it like a broken faucet. If the pipe pituitary is cracked or blocked, the water growth hormone cannot flow properly. Height far below the average for age, often more than 2 standard deviations short. Delayed puberty, like late appearance of facial hair or breast development. A higher than usual amount of body fat around the middle, while arms and legs feel thin. Small hands, feet, and a youthful face. You can picture it by comparing a child's height to a doorknob. Most kids would be at or above the knob, whereas a child with pituitary dwarfism might be well below it. Doctors usually plot the child's height on a growth chart to see the pattern. Perform a growth hormone stimulation test. Scan the brain with MRI to look at the pituitary. Treatment mainly involves daily injections of synthetic growth hormone, much like giving the watering can that was missing. With regular use, many children grow several centimeters each year. Because the problem comes from inside the body, it cannot be completely avoided. However, early checking of growth during pediatric visits can catch it quickly. Protecting the head from serious injury, treating brain infections promptly, and avoiding unnecessary radiation to the head can reduce the risk of damage to the pituitary. New advances include long-acting growth hormone drugs that need only a weekly shot, making it easier for families. Research on gene therapy that aims to correct the underlying genetic defect. Studies on using IGF-1, a hormone that works downstream of growth hormone, for children who do not respond well to regular GH injections. These developments are like upgrading from a regular garden hose to an automatic sprinkler system,